So we look at another issue, all right, for a developing fetus. Now, this is what is known as what? Intrauterine fetal demise. Of course, demise is death. They are just using a better word, just to cover up demise, Sometimes it looks at me like the medical profession. They'll just be covering up things. So the intrauterine fetal demise is also known as stillbirth. Refers to the death of the fetus in the womb after 20th week of pregnancy. Baby is dying after 20th week of pregnancy. So it's a deeply tragic event. Of course, the mother has been expecting her baby, her friend. The mother gives birth to the baby. Together, they suffer the father. It's a tragic event that affects about 160 pregnancies in the United States. Let's define it. You are losing the fetus at week 20 or after week 20. It's not a miscarriage. So once the baby has gone past week 20, we classify this baby as an individual. If it is below week 20, we just say it's miscarriage. You understand? So types of stillbirth: if it's early, between week 20 to week 27. If it is late, between week 28 to week 36. If it is term, the baby is almost coming out, week 37 or later. You understand? So you like this image? You can just pause to look at it. All right. So this intrauterine and fetal demise can result from a variety of medical complications, genetic complications, environmental factors. All right, placental problems like placental abruption or dysfunction, umbilical cord accidents, like umbilical knot. The umbilical cord is tying on itself. Okay, and you need the umbilicals, because it has the arteries and veins that transport oxygenated blood to the baby. Takes away the oxygenated blood, the baby can become suffocated. It could be infections, like the mother has syphilis, HIV, malaria. If you give it to the baby's immune system is not as strong as your own. The baby can just die. Birth defects, chronic maternal illness, fetal maternal hemorrhage, post-term pregnancy. The pregnancy has gone past that normal time that one baby should stay in the stomach. Okay. So risk factors is this: maternal age. If the mother is so young or the mother is above 35, right? Obesity, the mother is too big, smoking, substance use, previous history of stillbirth, right? Multiple pregnancies, twins or more, poor prenatal care. So they're supposed to be monitoring you and your baby to maybe be treating some 1 or 2 infections that you have. You are not presenting yourself. Or maybe economical issues, though, or there was no good hospital, So diagnosis and management is this. Diagnosis, just ultrasound, all right, and on the ultrasound you get to dictate that the baby is not moving, the baby is just, the heartbeat is not much, Management may involve induced labor. That's if you were close to giving birth, or cesarean section. Or sometimes the baby has already died, so they have to take the baby out. Post-delivery care, right? Physical recovery, emotional support. For a mother that will lose her baby is so painful. You didn't get to meet them. All right. So that's it for intrauterine fetal demise.